it's been the last time you visited the program over in the AOT garage.
Yeah.
Yeah.
No, it's good. You've been here. Pre-building.
We are live. It is
me.
March 21st. Again, we're in Senate Economic Development, Housing and General Affairs. We have Ronnie Bafton in the witness chair, the Executive Director for Vermont Works for Women, as mentioned. And we unfortunately are just in a time crunch with bills coming over from the House. If you can, you're welcome to stay for the next witnesses. They are some of our lowest paid workers who are majority women, our home care workers. And we just learned yesterday from the wage report that indeed confirms they are probably among the lowest paid workers.
But we didn't need the wage report to confirm.
No, but many are making less than $50 an hour
Yeah.
when we ask who's making less than $50.
I know folks are trying to do something
Yes.
about that, so remember when our money goes.
That's right. Yes. No, and I
That's what
agree.
they're trying to do.
Yeah,
Provide
agree.
health work,
Exactly.
personal care services.
So thanks so much for being here in person, and we'll turn it over to you for updates on how things are going for Vermont Works for Women.
Well, and thank you for having me and allowing me to be brief with my comments here. And thank you for highlighting these discussions and bringing in workers and really focusing the attention there. Vermont Works for Women is an economic justice organization that really works to advance gender equity and support women and youth in any and all stages of their career journey. And as an organization, we really believe as a state, it is no longer just an opportunity to talk about diversifying our workforce. It's now an obligation. Vermont can no longer afford the labor demands that we have and supporting our families and communities where women are still predominantly the caretakers of our households across Vermont. Vermont Works for Women really seeks to approach our work from really three different sides. We start with our youth programming, which is to build curiosity, exploration. Let's get tools in hand. Let's get youth into our career and tech centers. Let's expose them to these non-traditional careers to really build that confidence at a critical age in middle school. We then go into our women and adult programs. Those programs really focus on a holistic approach, whether it's certification training to upskill women who may not be making a livable wage right now, whether it's getting women advocacy to support them in their current careers. They want to increase their pay, they want to have a promotion, and they want to navigate what that looks like, or they need support and not knowing what they want to do, but to explore career pathways where they can find a livable wage. And then we also really try to look at learning and work environments. There's a lot to be said about giving a voice, a certification, a skill to women and youth, but there's a lot more to be said about shifting our work and learning environments to be more naturally and organically welcoming, to dismantle the policies and practices that have historically hindered these populations from thriving in these fields. And so we work with employers and schools and learning institutions to really navigate what are some of the stereotypes and biases that exist. Why haven't populations historically gone into these fields? And where can we help drive those conversations forward? So it's really trying to look at not only the direct participant support, but also looking at the long-term gains of these learning and work environments. I'll give a really quick example of why intentional programming matters. Just this Tuesday, we were at Randolph at the Career and Tech Center.
Fabulous.
We do our Career Challenge Day, which is one of my favorite programs, but we take any of the sending middle schools. They get to bring their girls and gender expansive youth to come for a full day to experience every program those tech centers have to offer. And it is not just walking in and looking at a demonstration of a tire being switched, it's physically getting your hands and doing the curriculum work with it. We had 125 girls that attended this day on Tuesday. We maxed out the number of girls that we can have there. Many of these girls, this is their second or third time coming in middle school. You can go in sixth, you can go in seventh, you can go in eighth. And we want to continue to bridge this exposure and bring it in.
So all the sending towns.
All the sending towns can go, and
to that.
we do these career challenge days at tech centers across the state. So we partner with a lot of middle schools to really bring them in. And I think what is fascinating about walking around that day, there's 125 students that are so eager, that are so excited, that are loving watching how to torque on a diesel truck, that are loving how you could all of a sudden do a felt sander and know how to switch it quickly and what's the intention. And yet, when I also walk around that, we don't see females enrolled in those tech centers. We see one female in electrical, one female in auto, which is also our only female in auto in the entire state of Vermont.
In Randall?
Yes.
Oh, great.
And we also only see one female in any of the construction trades work. So there is something happening, whether it's messaging, whether it's conversation, whether it's intentionality, between what we see as far as demand, exposure, and curiosity in that middle school that is not translating by the time they get to high school and by the time they're in adulthood.
Peers.
Yes, it is a lot of conversation and peers. And so we do a lot of work to work with guidance counselors, to work with teachers. I mean, a simple example, and it was a great day. When you're going into a diesel program, you don't need to be making charm bracelets with soldering iron. We want to be torquing the wheel and seeing how to do it. And it's that idea of this is what girls want, not let's expose them to everything and let girls decide what they want to do. And so as an organization, we really try to combat these head on and really address them head on. Everything from the posters you see hanging around the walls to the policies to the way that you're talking about the programs when you're going into the schools. So we really believe it has to be this full holistic approach to really be intentional about what you are doing from all sides of it. I will say that a lot of our programs, so our Trailblazers Trades Training Program is another similar one. These are now all across the state. They're in Brattleboro, we're in South Burlington right now, we're in Newport in the next cohort, down to Rutland, and then back up to Perry. These programs max out with participants. They are never not full, they are never not in demand. And yet we are still not seeing the translation into the workforce. We have 75% of our graduates that want to go into a trades field. We right now have close to 30% that started in a trades career and left because of the environment at those work sites.
Yeah.
There has got to be a conversation around, we can't just train them, we can't just offer a job, we have to be intentional about the retention.
Yeah, Senator Clark said.
So Ronnie, I think you have been in conversation with Matt Musgrove,
Yeah,
Greg, about
Yeah.
this because
But our other union shop.
the
Yeah.
other, I mean, this is just.
If you ever want to have a young person come in and tell us about their experience,
yes.
I think we welcome that so we have a better specific sense of the issues they're facing.
Well, and I'd love to have the student that's on from Randolph Career and Tech Center. She
Yeah.
was a middle schooler who went to our Career Challenge Day.
Mhm.
She then went into the Tech Center. She is the only girl in automotive right now, but she's
Wow.
thriving. She's also the only student that has 3 job offers post-graduation.
Yeah.
There is a high demand
Oh,
for it.
they.
So bring
everyone's
up a
desperate
few
for it.
people.
Yes,
a
we
few
would love
stories.
to and bring them in. We also are
Mhm.
happy to send written testimony that we've collected from participants. We know it's part of French, but we would love to
Or
bring them in
film,
here.
Or film them. We
Yes.
just-
So bring those written ones alongside 2 to 3 stories that you
Great.
don't have. full
And it would be
stories.
great to hear about some of the Tech Center experience of girls that go to that.
And the Hartford Energy Program.
Yes,
being-
and
it is also kind
Yeah.
of exciting.
it is. And the other thing too that we're really starting to see, we know there's motivation. Some of our highest demand careers between electrical and construction, those are what we have participants coming to for. We
Mhm.
know there's a need. We've got to figure out the translation to the actual work environment.
Right.
Where is it that it's not bridging a connection? But when we've been able to be intention, I will tell you, one of our greatest partnerships is with the Agency of Transportation here in Vermont.
Right.
They are phenomenal. They engage with our work through their gender equity services. Their crews are trained. They host our Trailblazers graduate. They are really accommodating when people are hired. If there's an issue, if there's a challenge, they come to our organization so we can work on it together.
Mhm.
And it just truly shows what that intention can do for
Yeah.
long term.
Some of us participated and changed the story.
Yeah.
Throughout Vermont Works for Women and was about 18 to 25-year-old women.
Yes.
So, you know, we
Yeah.
care, we deeply care. You
Yeah.
have a former ED on
Yeah.
House Appropriation. Senator Clark.
So one of your biggest partnerships, when I first met you about 20 years ago, I mean, when I, not you,
Yeah, I was like,
Yeah,
oh,
the
I've been
organization, yeah.
under a rock.
at Vermont Works for Women. I first met with your biggest partner at that point, which was the Department of Corrections.
Yes.
And you trained women at the Windsor Prison, and they built affordable housing, which we then located in Creighton Springfield, which was fabulous. You trained contractors, electricians, plumbers, and electricians, and it was fabulous because these are all, this was great. And what we didn't do and didn't have the money to do at that point, but what we desperately needed to do was to attract them and seeing how they've done in their construction careers, which I wish they had.
Yes. Now I will tell you that Mod Home program, 100% of the women 5 years out never went back to the facility. One of those women that we trained in that is one of our current instructors for
That's
training.
awesome.
Exactly. So my point
Yeah.
is, that was a great partnership.
Yes.
That was, you were marrying need
Yep.
with skills.
Yes.
And it was such a great partnership. And I know you haven't been able to do it in the same way in Chittenden, which is just heartbreaking. But wherever the women land in the future, I will hope this is a robust piece up there.
And
because-
we might have Senator Harrison walk through the door. Her car was not unlocking for her.
Oh, no.
So she's on her way
Okay.
here from elsewhere in Montpelier.
My trunk froze, I couldn't get my ice cream.
Yeah.
Took a long time to defrost.
Such fun things on the first.
Anyway, I'm just, I guess, women coming into these, also the need level for the women, that then
Yeah.
need and skill, and, I mean, that all so many.
It does, and Department of Corrections is still one of our biggest funding partners for the work. We're still in the facility.
Yeah.
Facility has limitations is what you can do. I will say, because I know there's a lot of conversations about a new facility.
Yeah.
There's opportunity currently. If we would be able to take women out, and train them at our South Burlington site right there now.
Mhm.
I mean, the women's incarcerated facility, especially the population that's there now, you know, most of those women have graduated high school. Most of those women are motivated for a good career to get on a good path. Trades work would be a great vocational training to be
So
able
what's
to
the
offer.
barrier to that? Why are they not
There's not
participating?
space in the facility. for us
Oh,
to
I know
train.
about that. I mean,
We're not
when
allowed
you
to
said
take
you're
them.
able to take them out of the
We
facility.
can't. We're not allowed to right now. And so if we could change that to be able to do
So
a
what do we
community.
need to do to change that?
That would be community release programs. It would have to be something, it was removed, I believe, back in the late eighties or early nineties. It was removed for community release vocational training. It would have to be put back in.
We'd also need more staff in corrections, not to throw up a barrier.
They would have to have a
go-
staff member with. them.
Right, yeah, but so I do wish our Senator Harrison, who's the vice chair of institutions, was here, but you're on the opposite.
And I'm the one who's, I'm the only one in the room who's lived that, watching that experience and I mean, it just was so amazing.
Yeah.
So, as a workforce person, I really care about this.
And it's a huge untapped potential. And if we think about what the women's facility, we only have one women's facility, and mind you, we don't train in the men's
Yeah.
facilities, but the potential is there too.
Oh,
It's
it's
huge.
a waste.
And I was gonna ask if you were partnering with Jillian Manton at CEDO, who's the economic development director, who just
know we
got
partner
a
with
huge
CEDO for-
multi-million-dollar grant for the city to do infrastructure, but she is the workforce development person, and that money came because of a pitch to diversify
Yeah.
the training programs and the workforce programs.
Well,
that
and
were-
that's another huge opportunity for Vermont as far as federal competitive funding.
Yeah.
2 years ago, Vermont Works for Women wrote an equity and infrastructure framework that basically outlined how can you meet the mandated equity initiatives that are now
Right.
in those infrastructure
Exactly.
funding.
She is the
Yeah, and it's one of
Masterful
those, we
kind of-
have this opportunity to do it in Vermont.
Yeah.
It's like Vermont struggles to compete
yes.
in some of these, but we can still do it.
Perhaps a new mayor in Burlington
Can help
be very
drive it.
open to this program. And if there's some kind of work we can do on community release,
Yes.
I
I would
think
love to do
that.
that.
I mean, this
because
is a
it's
high
workforce
motivation.
It's a
correction
workforce thing,
and
I'm happy to
all
work
of
on
the
that.
things.
And I think as an organizational structure, the ability there to very easily translate that into a
Yeah.
quick turnaround program. We can easily, even if
Right.
it's more women, imagine what that's doing to drive
Oh, yeah.
more women into the economy. I will also quickly mention that a lot of our programming, not fully, that has been funded through our collaboration with Serve, Learn and Earn, which
Mhm.
is BYCC,
Thank you for saying that, yeah.
and Audubon. Unfortunately, it's funding for that is not looking great in House appropriations right now.
Okay.
It's not in there currently, but that would be a big hit for that. And I think at this
Mhm.
point, it's really seeking to try to, how do we make long-term investments in workforce development across nonprofit collaborative organizations?
Well,
Okay.
and we need to be working to coordinate all that better.
Yes.
Yes.
Okay.
Yes.
And $2 million is not a lot when we think about other things we're asking for and.
Well, and I also think about how they drive towards initiatives. You know, these are 4 organizations where these programs aren't new or
Mhm.
emerging, they're existing and they're
Yeah.
already driving into state initiatives, whether it's flood recovery or housing. I love that we're building more housing. We are 100% gonna need more people
Yeah.
for housing.
Right.
And so it's really trying to start young, and I will say there is massive untapped potential in our
Yes.
Our career tech centers
Yeah.
are phenomenal.
So as you heard, we have some mostly women who have very short breaks and opportunities to testify before us. So I really do have to honor that and move on.
Yes.
Senator Harrison, we're glad your heart let you come here.
Yes.
We've been hearing from Ronnie Boutzen from Vermont Works for Women, and we've been talking a lot about getting our women in our corrections facility back
Oh.
outside to do workforce. So that's
So
a
we're gonna
three
work on it.
committee effort.
Good. And we're happy to address any questions. I know it's a time crunch, so if there's ever more
Yeah.
that you want to direct my way or.
Well, let's start an email to you
Great.
about, getting back here with some more young women and the
That'd be
barriers they're facing. And, we'll use that email to start a conversation about, the relief, what is it called, training relief.
It used to be called a community release program. I don't know.
I think what we need.
That was many decades ago that policy existed and then was removed.
Yeah, but also we trained them in the Windsor prison, which was.
Right, but let's move on from that
Yeah.
because they're in a
So
tight
15
facility and let's get them out into Burlington and South
Exactly.
Burlington and use the
Let's
workforce.
put them into work site. That are motivated.
The $15 million construction CTE money that we gave 2 years ago for, I would hope you'd be tracking that with our CTCE centers to see how many kids
So-
that we can get into that.
We work very closely with Ruth Durkee over at AOE to track female enrollment. I will say it's stagnant. Female enrollment in tech centers continues to still
Yeah,
stay
so we
low.
need to talk to the women themselves.
Yeah.
Where it's in the incarcerated.
No,
Oh,
career
alright.
tech centers.
Oh, okay, the CTE.
Yeah, for
Okay.
non-traditional students. And yes, I think bringing in our participants in those
Mhm.
programs to hear directly.
Mhm.
They need to meet our Hubbardton woman.
Yes.
Our home builder from Hubbardton,
I know, Jean.
Jean.
Thank you so much. You're welcome to stay again if you've come all this way. I see Shannon and Heather who are on our agenda. And then, I had Anne, mine and Albrecht on our agenda too. I don't know if she's with George or who plans to speak first, but we're grateful that we could be with you again and that you've taken time out of your busy schedules to continue this conversation with us about the budget and, we will say, I'm sure this is nothing that you need to hear, Shannon and others, but we had our wage report, the beginning of our wage report yesterday from the Department of Labor, and they named home care workers as the 18 lowest paid sectors in the state. So we are sorry about that, and it's partially our fault. And so we are looking forward to talking to you again about the urgent need to bring your wages up. And whoever's with you, hello to that person as well.
All right. Hi, sorry, I'm just adjusting my view so I can see both you and what I've written.
Yeah.
Glad you could figure that out. I can never figure that out.
Right? Yeah, no, we're trying. I think I'm just going to be able to see what I've written, so I cannot see you.
That's okay.
Okay. So I'm speaking in regards to Home Care Workers United today, AFSCME 4802. Thank you for inviting us to speak today. I'll start by introducing you to the work that home care providers across the state are doing, then to some of the people we are working for, and finally, to what we need your support with. The workers that we're talking about today go by many titles, such as home care provider, direct support professional, and caregiver. We support people to live in their community rather than institutions. Sometimes we are their primary care providers, and other times we provide care so that their primary care providers can work and tend to other responsibilities. We ensure that the people we are caring for can live meaningful lives. Our jobs vary widely, from preparing and feeding meals, assisting with daily medical routines, showering and toileting, supporting people with mobility issues, guiding people through behavioral challenges, giving emotional support and companionship, providing transportation and assistance to access the community. If you ask 5 home care workers to describe their jobs, you will get 5 different answers. But the themes you will notice are giving, caring, supporting. People rely on us to prevent imminent and future risk to their health and safety. Vermont Home Care United, AFSCME 4802, is the statewide union that represents direct support providers who are employed through Medicaid-funded programs under the Agency of Human Services. At this time, the covered programs are Adult Family Care Respite, Brain Injury Program, Children's Personal Care, Choices for Care, Flexible Choices and Moderate Needs, Developmental Services, Family Managed Respite, and Participant-Directed Attendant Care Services. There are thousands of Vermonters accessing these services. Since 2016, the number of providers enrolled in these programs has plummeted from over 7,000 in 2014. Oh, I'm sorry. Ms. wrote something there. over 7,000 providers in 2014 to 5,343 today, based on payroll data, putting many vulnerable Vermonters at risk. The impact of this shortage of workers goes much deeper than that, though. Family members who cannot achieve financial security because of caregiving responsibilities, children who cannot attend school or meet their own needs without in-home support to their parents, shared living providers who burn out because they cannot get the breaks that the designated agency assured them they would get once they hired respite providers. We are talking about stability and quality of life for many thousands of Vermonters that are dependent on a vibrant and diverse workforce in every corner of the state. When I asked a recipient of self-managed care from the Developmental Services Program what they wanted you to hear, they told me, "Be nice to the staff, not mean. It is not helpful to me. Staff can't quit." The young adult that I work for wants you to know that these supports lessen the burden on my family. This is another person. Lessens the burden on my family. It helps me build a relationship with someone who focuses on me. It provides flexibility so we can have long-term relationships. With agency employees, this person has seen continual turnover. I, on the other hand, have been able to provide them with consistent personalized support for 14 years. Why can't the state recruit more providers? It doesn't seem that they are trying. Number one, the wages are often terrible. The state creates care budgets based on a base pay rate of $14.05 per hour. Could you survive on that? Well, some person. No. Well,
You asked, we're answering.
Thank you.
All right.
While some participants opt to receive fewer hours of care in order to pay a higher rate, many cannot do this. Other care providers are family members who have no choice but to accept this wage. Otherwise, there will be no one to care for their loved one. There are no benefits, no support to afford health care, no retirement account, no HR department to help you navigate workers' compensation claims or family and medical leave needs. The wage is all you get, and most of us have to use a significant portion of it to ensure that we have a safe, reliable, and properly insured vehicle and/or home to provide care in. Number two, most of us are ineligible for paid sick time, myself included. Many home care providers work part-time or work for multiple clients, meaning that they are either not allowed to accrue sick time or they accrue it at such a low rate that it is useless. There is no programmatic support to help a worker find coverage when they need time off. And since in most cases we cannot work if our clients are sick, hospitalized, or out of town, we often find ourselves available to work but without a job to go to. Number three, training and professional development is extremely limited. Vermont Home Care United is piloting the first paid CPR, AED, and first aid class for contracted support providers this weekend. This is a life-saving training that community health agencies are funded to provide and then often mandated to provide, and their workers get paid to attend. Since we are seen more as gig workers than professionals, we have been excluded from access to these trainings until now. We will be doing this training on a Sunday, many people's day off, because that is when client care will be least impacted. We are also hosting a system of care training with a retired state of Vermont policy specialist at the end of the month. Our hope is that this will help. This educational opportunity will allow more professionals to get to better understand the structures and funding of our positions to protect our rights and our livelihood. The state has provided us with some funding for these trainings, but not with support to coordinate or publicize them. With such a widespread workforce, getting workers the training that they need to excel and remain in this field is an uphill battle. Number four, there is no centralized job board or database to help people who need support connect with people available and approved to give support. We have asked the state repeatedly to work with our union to create or adapt an appropriate job board, but we have been denied this collaboration. When a care provider loses a client, either because a program changes, their needs change, or a plethora of other reasons, there is no easy way for that provider to find a new employee, and they often exit the profession. Someone said to me the other day, "I don't support higher wages for workers. If they don't earn enough money, get a different job." Wow, is that the world we want to live in? Where will that leave disabled and ill Vermonters? What did they do to deserve this treatment? When Brandon Training School closed in 1993, a residential institution for people with developmental disabilities, Vermont took leaps forward to reduce the number of institutionalization of those who could not live independently. And the state promised these people options for care in their homes and the community. We cannot neglect this promise and these people. Furthermore, in 1938, the US government passed the Fair Labor Standards Act, bringing protections and stability to tens of thousands of workers, creating the minimum wage and shaping the direction of our modern employment standards. Because caregiving responsibilities typically fell to women, and most commonly to Black and Brown women, our industry was excluded from FLSA. Nearly 100 years later, we are still fighting to catch up, as you just noted with that most recent study. We are not seen as professionals. We are not paid a respectable wage. We are not offered a seat at the table where the decisions are made about programs and the people that we have dedicated our lives to. If you want to be a part of solving the wage gap for women and people of color, supporting an increase in wages for home care workers is an exceptional place to start.
Yeah. Thank you, Shannon. Well said.
Thank you. Vermont Home Care United is currently in negotiations for a new 2-year contract with the state of Vermont. I believe that the people we are negotiating with also want what is best for our clients, and that the employees of the Department of Health and Department of Aging and Independent Living do not want to see these programs collapse. I believe that designated agencies across the state understand the importance of self and surrogate managed care programs. Our hospitals, nursing homes, and community health providers are overwhelmed with unmet needs. Utilizing home care providers is an effective, affordable, and person-centered way to meet many of these needs. Our negotiations with the state are currently at an impasse. Vermont Home Care United recently proposed a livable wage based on the data in the most recent Basic Needs Budget Report, and the state countered with an increase from $14.05 an hour to $14.36 per hour. They dismissed nearly all of our other proposals, including improvements to sick leave policies, collaborating on a job board, and smoothing the way so that we can provide more access to training. Without discussion, we need legislators to support us by encouraging the Agency of Human Services, DAIL, and the Department of Health to ask for budget increases so that these services can be adequately funded. We need state leaders to seriously consider the livable wage data collected by your own committee when creating budgets that fund these care services. Without your help, our state will continue to lose home care providers while the needs of our aging population increase. Please use your voices as our representatives to help us move forward towards a more equitable society. Reach out to us at any time for more information or to brainstorm how we can collaborate with you to help vulnerable Vermonters.
Thanks so much, Shannon. I have made a note that we have a new Dale commissioner as of today.
We do?
Dr. Bowen was just appointed. I don't want to spread misinformation.
Yeah, there wasn't even, can I ask a quick question in the meantime? Shannon, did you say how many home care workers there are?
Yeah.
Our most recent data, which came from payroll information that was provided to us between the state and the payroll company they contract with, says, let's see.
Thank you,
George.
My name is George. I'm staff for AFSCME. I work with local 4802. I calculated this, so we get payroll data every month from Eris, which is the payroll company Dale contracts with. Because some providers don't submit their paychecks payroll at infrequent intervals. The last 3 months of Q4 2023, which is the last quarter we have all the data for, there was 5,639 providers on payroll over those 3 months. For comparison, back when we were first organized, back I think in 2014, various sources have listed the amount as over 7,000. Despite this, as you guys should know, Vermont has not gotten any younger. So that is the data I believe Shannon was looking for.
Right, and Shannon actually gave that to us at the top of her testimony. She talked about those numbers.
So
Yeah,
like,
Yeah.
my number is just slightly older than George's, but it is written in the testimony that you should be able to.
Yeah, I did want to explain how we got that number though, because it isn't like because if you go by month, then it's like closer to 4,000. But we don't believe that number is entirely accurate. Well, I mean, if it was, that'd be even more concerning.
Mhm.
It's closer to like 4,000 on a month by month basis.
One of the great things. Sorry.
you can go ahead and then we'll turn to Heather so she has equal
Thank
time
you.
as well.
Yes, one of the great things about this program, which we've been reminded by the state, is the flexibility that it offers to people. So some people have a provider that they see daily, weekly. Some people have a provider they see once a month. Some people may use a respite provider for 2 weeks out of the year. But it's incredibly important. It may be the way that a parent gets to take a vacation, or whatever it is that the primary care provider needs. That's why we have different numbers from month to month.
Thank you. It's helpful. Thank you. Heather, thank you for joining us.
Good morning, and I have with me Anne Minen Albrecht. And
Oh,
she's gonna
great. Okay.
testify.
Okay, that's helpful.
Hi, my name is Anne Minen Albrecht, and I'm an employer of a home health care provider. My healthcare provider is a proud member of AFSCME Local 4802, and I wouldn't be here without her help. It is through her incredible and intense dedication and the quality of care that I receive from her. I suffer from a multitude of major medical conditions which require 24-hour care, and per my doctor's orders, say that I'm not safe to be left alone. My caregiver has saved my life on a number of occasions, from a heart attack to frequent severe choking, falls resulting in permanent injuries to my back and knees, and the daily challenges of being a brittle diabetic, congestive heart failure, and COPD, just to name a few. Her home health care providers are a vital, important, and essential group of highly dedicated people. They provide critical life services to their clients, to those who deal with physical and mental disability, to those recuperating from injury or illness, or those of us among the 21.6% of Vermont residents over the age of 65 who are dealing and going through the aging process. Vermont's home health care providers deserve the utmost level of respect for the multitude of services they provide to our residents in need. They deserve to be paid a living wage. They deserve full medical benefits, including vision and dental. For the state to offer a wage of $14.36 in the bargaining process is blatantly disrespectful and a disgrace. It's not a living wage. It's not sustainable. It is barely making and eking out an existence. It is the main reason why we have lost so many home health care providers that are so desperately needed by so many. As an employer, I find it equally disrespectful to them and to each client they serve. When a person can make $18 at a fast food restaurant, but a home health care provider who is providing life-saving care can only make $14.05, we have a situation that is out of line and unrealistic. When you are considering and evaluating budgets and funding and the needs of the Vermonters you work so hard for, please remember that at some point, a beloved family member or you yourself will need the care and the service of a home health care provider. I hope you get a good one and that they have been paid the higher wages they need to continue to sustain our communities.
Thank you
Thank you.
so much, Ms. Albrecht. I don't wanna.
Yes, thank you. That was
Yeah.
really helpful.
Yeah,
Really nice.
absolutely. And it's helpful to hear, from someone who is benefiting from a home healthcare worker as well. Before we run out of, you have my phone, before we run out of time, because that clock is fast.
Is it?
Yes, about 2 minutes fast. Anyhow,
Well, it's 11:53.
I wanted to make sure to underscore and ask again, Shannon, George, anyone, what is the floor wage that you are asking for at this point? Because if this becomes a question of asking our appropriations committee to do something that the governor won't, I just want to know what the fund level that we're talking about.
So in terms of the floor wage we were asking for, we more or less did not get, I guess, the opportunity in the bargaining process to reach that point because we had our initial proposal, they had ours. It was, as Shannon described, tilting too far apart. Our initial proposal was living wage based off the report. We put it as I believe it was 21. And then of course in the bargaining process that would come down, they would come up as it's supposed to work.
So closer
So
to
it'd
the
probably
basic
be
need.
somewhere
The livable wage, which
closer to
was
the basic
2
need
years.
budget.
Yeah.
Yeah, Connecticut and Massachusetts both have around 18. So maybe if I
Okay.
had to pick a number, I would say around 18 if I had to pick a number. But my answer is of course off the cuff because we'd never had the opportunity with the state to, I guess, find that number.
Right. Right.
But
We don't want to make,
important part.
we wouldn't want to make under negotiate yourselves, but with UVM just getting to $20 as a wage floor, 18 sounds in the ballpark for the basic needs budget.
And the livable wage will be recalculated and out this December. When we do the basic needs budget and we my guess is because of inflation, it will end up being around $17 to $18 an hour.
Yes.
Howard
the
Center,
state's-
the largest, sorry.
Go
Howard
ahead,
Center
Shannon.
is the largest designated agency in the state. Howard Center starts at $20 an hour with benefits for the very
That's
There was a report done by, or a study done by Dale in collaboration with designated agencies. And designated agencies who in many situations also employ direct support providers, they're not independent, said they believed they would need to pay at least $20 per hour with a higher benefits ratio than of course the home care workers get in order to be competitive. If that's any sort of weight on this discussion.
Yeah, Senator Harrison and then Senator Clarkson.
No, that's fine.
Okay.
Thank you.
And Greg and Shannon, would you just remind me, what is the pay balance? Does the state pick up that entire salary or is it state and families? Do families participate in your cost?
Generally, no. There are some folks with more privilege who may provide a mileage stipend or a bonus, but that is a very rare situation. It is state funded, Medicaid funded.
Thanks, yeah, I thought that, but
And I guess I do, so you deal directly with Dale, you don't go through the designated agencies. Is that right?
really?
Or I don't
Yeah.
know, that's why I'm.
So it's some people do. Shannon does both actually. So some designated the designated agencies, many will employ direct support providers. They will also fund shared living providers who in turn will employ people who are in 4802's bargaining unit, independent direct support providers. But the workers we represent and negotiate that are in our union are not employed by designated agencies. They are employed usually either by their client, that is the Medicaid recipient, or alternatively by an SLP or guardian. Either way, it all comes from Medicaid funding. We negotiate with Dale mostly, and the contracts with the state of Vermont.
Currently, most of, so for some of these programs, it's the designated agencies that go to the state requesting the budgets. So they're intimately involved in getting the funds, but they are not involved in overseeing the services. Most providers don't even know who their client's case manager is or who manages those things, which leaves us without someone to turn to when things get difficult.
So I have written down that we can request, and they can deny us that request because of the negotiation, but we can request to hear from Human Resources and from the new commissioner of Dale, Dr. Jill Bowen, who was appointed today. So
Great to meet her.
yes. And in the meantime, we can look at, with our joint fiscal office, what we need HR's help, probably some kind of calculation to get to at least $18 an hour. And we can look at multiple pay scenarios, but we can at least have that data as we discuss our budget priorities.
This is Jill Berry Bowen.
She
Jill.
just got here from Philadelphia.
That's
So
not the same one.
Your city.
Oh, Jill Berry Bowen was former CEO of Northwestern.
oh, okay, she looked like Philadelphia, New York, and she
No, this is
Might
the
be,
Philadelphia.
Motion.
George, you unmuted. Is there something you wanted?
Yeah, I
respond
just
to?
wanted to briefly finish off by saying it's worth noting that in these calculations, so as I was saying, the designated agencies do employ people in the same position. The Medicaid reimbursement rates for those positions my data could be 2 to 3 years behind on this, but it shouldn't be dramatically different. That their Medicaid reimbursement rate for the same job is roughly twice of the Medicaid reimbursement rate for the same position in our unit, which is something we've been looking at and might be worth considering when you're doing these calculations.
And just to say, we are
Okay.
sometimes doing the exact same job. Sometimes one person is supported half by contracted staff through these programs and half by an agency. Exact same job. This person is a great example of that.
So can you put that in some kind of written communication to us so we can talk to the Health and Welfare Committee? Are you saying it's kind of a coding issue or the pathway someone gets work?
It's money, it'll be appropriation.
Absolutely.
Yeah,
No,
I know,
I-
but is it like, could you draw down more money from Medicaid for this than we're doing?
I think we have a set amount.
Okay.
And we should chat with Jane.
Right,
Jane.
yeah.
And when you send whatever you send, please explain how the Medicaid reimbursement translates to the wage, because it sounds like it's a little different.
Oh, it's way low.
Well,
The
No,
benefits
well,
ratio is a lot higher for the agencies.
so is their hourly rate twice higher? Is that what you're saying?
The hourly rate is higher and the benefits ratio is higher for the agencies because their actual jobs that receive the actual support that they kind of need, or at least more support than the home care workers get.
Okay,
Shannon
and I
can-
think there's some. There.
Well, I think, and correct me if I'm wrong, this was the program that got set up that allowed the individual to hire their own caretaker. And frequently that was the spouse, because if the spouse had to work, then pay a caretaker, they went broke.
Mhm.
So this allowed more for families to care for.
Mhm.
But it also allows them to hire somebody outside.
Okay.
Right.
So-
That's true.
it is 12:01 and I should let our committee get lunch. But I think most of you have my email and we're gonna need to do a little bit of work on this outside of committee to make sure we don't undercut you, but at least we set up different scenarios about what our budget might be able to start to move you forward and have that conversation. And I do want to say we do have to have the conversation with public works because they have human services built into their work. But we will take some responsibility for those conversations. And we really appreciate you finding time that you don't have for this conversation. We have not forgotten about you and we will work on scheduling some more folks and letting you know in case you want to hear either live or afterwards the testimony of these other stakeholders. And we will have some additional conversations and try to get some figures together to talk to our counterpart committees. Thank
Thank you.
Yes, thank you.